Good afternoon, everyone. This is your Congressman Dave Joyce. Welcome to today's telephone town hall. For those of you who are new to this forum, I've been using it to discuss issues that are important to my constituents since I was elected in 2012. However, this is the first time I've used a telephone town hall to address a public health crisis. This is an unprecedented time for our country and for the state of Ohio. It's very important that we continue to take proactive, precautionary steps to limit the spread of the disease and stay informed. This is a time for facts, not fear. Today, I'm honored to be joined by some of Ohio's top health officials. Here on the line with me to keep you informed about the coronavirus outbreak are Mr. Lance Himes from the Ohio Department of Health, Dr. Don DeCarlo from University Hospitals, Dr. Tom Collins from MetroHealth, and Mr. Ron Graham from the Lake County General Health District. I want to take the time to thank them for engaging on this call and helping me keep the people of Northeast Ohio informed. If you wouldn't mind, I'd like to give each of you briefly introduce yourselves and tell our callers what your official position is and what your role is in the Buckeye State's response to the coronavirus outbreak. Start with you, Mr. Himes.
Thank you, Congressman Joyce. A very pleasure to be here with you and all of your constituents today. My name is Lance Himes. I'm the Chief of Staff at the Ohio Department of Health, and we are leading the public health response in collaboration with our local public health partners, our local health departments, and Governor DeWine and Dr. Acton have been very aggressive, setting forth statewide policy to flatten the curve, is the terminology we're using to reduce the transmission of COVID-19 here in Ohio. So we've been busy issuing orders regarding schools, mass gatherings, restaurants, and bars in order to limit those public interactions which may transmit the disease. Also, I just want to put in a quick plug for our website, which contains very useful information for Ohioans, and that website is coronavirus.ohio.gov, and it contains practical checklists of things that you can do in your homes to be ready and to prevent transmission of COVID-19. Thank you, Congressman Joyce.
Thank you. Dr. DeCarlo.
Thanks, Congressman, for allowing me to participate on this call. My name is Donald DeCarlo. I'm the president of the Geauga Medical Center, and up until last summer, I served for 5 years as chief medical officer for the hospital. I'm also a practicing board-certified emergency medicine physician for the past 20 years. I'm working with the community hospitals and the system to make sure that we're prepared to care for and treat COVID-19 patients.
Well, thank you. Dr. Collins from MetroHealth.
Thank you, Congressman. My name is Thomas Collins. I am an emergency medicine physician at MetroHealth for the last 26 years. I am the Associate Chief Medical Officer or Medical Director of Professional Affairs, depending on what day it is. And I'm also Medical Director for the City of Cleveland Department of Public Safety. And so both MetroHealth and the City of Cleveland and our public health partners have all been meeting and talking and conferencing, calling each other all hours of the day, helping prepare our community. And it's an interesting perspective for me because when MetroHealth was founded about 180 years ago, it was in response to a cholera outbreak, another public health emergency. So this really rings true to our core at MetroHealth as far as being able to support our community at this time.
Thank you. And Mr. Graham from our Lake County General Health District.
Hello, my name is Ron Graham. I'm the Health Commissioner at the Lake County General Health District. I have about 20 years of public health experience. I had the luxury of, working through anthrax, 9/11, floods, Zika virus, Ebola virus, so a lot of expertise. And then working with our partners and just helping to coordinate all the entities that create a public health system, from daycares to churches to the political subdivisions. So we've been spending about 12 hours a day on the phone coordinating our actions. But thank you for this opportunity.
I want to thank you all again for taking the time to join this call and answer some of the questions at the forefront of minds when it comes to the coronavirus. Before we begin addressing questions, I want to give more people the opportunity to join the call before we lay out the important health-specific facts. And I'd also like to take you a moment to walk you through some of the actions that I've taken here in Congress to strengthen our nation's response to this outbreak. Ensuring the health and safety of the American people is one of the Congress's top responsibilities. That's why on March 5th, I voted for the Coronavirus Preparedness and Response Supplemental Appropriations Act. That bill, which was passed by the Senate and signed into law, included more than $4 billion to make diagnostic tests more broadly available, to support the treatments to ease the symptoms of those infected with the virus, and to invest in vaccine development and procure vaccines when they are available. It also provided $2.2 billion for the CDC for a robust effort, including nearly $1 billion exclusively for state and local response efforts, like you have heard here from the Ohio Department of Health and in the hospitals and the Lake County Health Department. $300 million for CDC's infectious disease rapid response reserve fund to prevent, prepare for, and respond to diseases, and keeping our nation prepared for positioning us. Funds in that bill were also made available for the Food and Drug Administration to protect the integrity of medical products manufactured overseas and identify and prevent potential shortages. The legislation also allowed an estimated $7 billion in low-interest loans to affected small businesses. On Friday night, technically it was early Saturday morning, we passed another coronavirus aid package, but I'll get into that in a bit. But let's get started answering some of the questions that you've been asking. If you don't mind, Mr. Himes, I'm going to start with you. What are the symptoms of COVID-19, and can you explain the difference between its symptoms and those of the flu, allergies, or other illnesses?
Well, thank you, Congressman Joyce. So COVID-19 is one of 7 coronaviruses. It's a respiratory illness that can spread from person to person via respiratory droplets, and that can be when a person coughs or sneezes. The symptoms are fever, cough, and shortness of breath, and those symptoms may appear in as few as 2 days or up to 14 days. I believe the median amount of time for symptoms to appear is about 5 days. It's highly infectious, and there are currently no pharmaceuticals or a vaccine. I would defer to one of our doctors on the line for the difference between that and flu symptoms.
Well, thanks. Dr. DeCarlo, can you speak to how COVID-19 spreads, and is it possible to spread it without any symptoms?
Yeah, so this virus is spread mainly from person to person, and it's through the transmissions through respiratory droplets. So generally what happens is an infected person coughs or sneezes, and then the recipient, usually the droplets, can be inhaled into their lungs. And part of the really challenging part of managing the COVID-19 outbreak is that these droplets can last on surfaces for a couple days, and the person that is infected can be asymptomatic or have no symptoms for up to 14 days prior to them becoming ill.
And if you would, Dr. Collins, I know as part of it was addressed there by Dr. DeCarlo, but is there any, can you tell us how long these COVID-19 bacteria or virus will live on surfaces like door handles, chairs, or pieces of mail?
Well, without getting into super specifics on different surfaces, remember that we've only been dealing with this virus for about 5 months, and so there's very limited amount of data about how long the virus will still be viable. This virus will still be viable on different surfaces. There's some data that we learned from the first coronavirus, SARS, that was over 10 years ago. But the reality that people need to understand is on surfaces, it can last quite some time. So don't assume just because you cleaned something 2 hours ago that the next day it's not going to be pretty dirty already. So cardboard, stainless steel have very variable lengths of viability on those. Cardboard may be a few hours, stainless steel may be a few days. I think the take-home message for everybody to understand is you need to be careful when you're touching any surface when you're out in public. And if it hasn't been said yet on this call, I'll say it for the first time, and hopefully we'll say it about 100 times. Everybody should thoroughly wash their hands, at least for 20 seconds, multiple times a day.
Yeah, I appreciate that, Doctor. I've washed my hands so much being in D.C. last week, they're raw. Mr. Graham, can you what can people do to prevent the spread of COVID-19, and how can all of us in the county or throughout the district contribute to that effort?
Yeah, so luckily, while we don't know a lot about the virus, we do know that the universal precautions are a great way to stay ahead of this and to keep your family safe. So one, first and foremost, is we need you to stay home and your family stay home, your children, when you're sick. Social distancing, which we'll talk about, is really avoiding contact with people who are sick as well, limiting your 6 foot touch to others. Basics like getting good sleep and proper nutrition are still beneficial. But washing your hands, I'll repeat what the physician said. Wash your hands with hot soapy water or 60% alcohol sanitizer. And you just cannot do that enough. Anytime you're going out into a new environment, out to pick up food or anything, we really need you to wash those hands repeatedly. Make sure it's a clean towel that you're drying with so you don't recontaminate yourself. Basics is cover your mouth and cough or sneeze into your sleeve or your elbow. Most importantly, when you're touching those surfaces, please break the habit of touching your eyes, your nose, your mouth. Those are membranes that can actually really absorb those droplets that they were talking about. High touch surfaces, doorknobs, door handles, keyboards, smartphones, those kind of electronic devices are just very, very dirty. Those need to be cleaned, repeatedly throughout the day. If you're an employer, if you're at your home, one thing I want to reiterate is call your doctor. Make that call out to your physician or your medical provider. Uh, Unless it's an emergency, don't run to the ER. We need to know how to triage these individuals. There's limited testing. There's ways to help control the spread even at the physician's office or the hospital. We really need them to call ahead and walk through that process.
Yeah, you make a good point, but can you go a little more depth into who exactly falls under the category of high risk of serious illness with COVID-19, and what should people at the higher risk end of this do? That's solid advice about sheltering in place until you know you have it, but could you get into those other high risk aspects?
Yeah, so certainly what we know of the virus now, the older adults over age 50 are definitely at risk just from a maturity standpoint, biological standpoint. Anyone with a medical condition, heart disease, diabetes, lung disease, congestive heart failure, those kind of things that you'll hear, those are ones that are going to really make it very challenging for you to get through and recover from the COVID-19 virus. A lot of times, with some of the complication, it really makes recovery extremely difficult, and if not, does result in death. Those individuals particularly need to separate themselves from potentially asymptomatic carriers, which could be the younger generation, the younger under 18. Try to refrain from going out into the public as much. Anything that's non-essential travel or group settings, really steer clear of those as much as you can.
Dr. DeCarlo, do we know if it's possible to have both the flu and COVID-19?
Well, technically, yes, but it's going to be very unlikely that anyone would contract these two viruses at the same time.
Well, Dr. Collins, there's been a lot of talk about face masks and whether or not people should get them. Can you clarify for everyone who should be wearing face masks, and do they protect those who are not sick from getting COVID-19?
So there's
I think that's
various I'm sorry. So there's various types of mask, and so one of the things is it depends on what type of mask we use. The one that's most prevalent is the N95, as far as making sure that the virus is not exposed to the healthcare worker. As far as whether the general public should be out in public wearing masks, we actually are trying to discourage people from doing that, and sometimes it could potentially make it worse, in which the virus often thrives in very hot, moist, humid conditions, which essentially is what's happening when you have a mask that's covering your mouth.
Mr. Himes, can you tell us how the COVID-19 statistics compare to a typical flu season?
Well, thank you, Congressman. Certainly, as you can see from a worldwide perspective, the number of cases are increasing very rapidly. Typically, in the United States, flu is very prevalent, and it is a seasonal disease. And the number of deaths in the United States for flu range anywhere from typically 20 to up to 60,000 deaths across the nation. While we're not seeing those numbers with COVID-19, we're still very concerned because it's a new disease and the science is evolving. So flu, while it is comparable in many respects, we want to be just very, very cautious with COVID-19 because of its novel, which means new, in today's national and international transmission.
And Dr. Collins, while it's still a lot unknown about COVID-19, do we know if it's possible to get the disease more than once?
Typically, with this type of virus, once you have it, you have some immunity. But again, our experience with this is still very new, and I think while we're all hopeful that that is the case, we'd like to have some of the science behind it before we are very comfortable with that.
Well, probably the most questions I've heard from constituents has been about this coronavirus outbreak have to do with testings. So, Mr. Himes, if someone believes that they have this coronavirus symptoms, what steps should they take to see if they meet the criteria to get tested? And once they meet that criteria, how do they proceed to get tested?
Well, thank you. So certainly testing is a hot topic, and if an individual believes they may have COVID-19 and they believe they have the symptoms, shortness of breath, fever, coughing, certainly with mild symptoms, the advice is to continue to monitor those. But if the symptoms continue to worsen, we're urging individuals to contact their health care provider, as Mr. Graham said, via telephone first. So if they have a primary care doctor that they work with, or perhaps an urgent care center, but call first, and they will help triage that individual, and they will do some screening, which would include taking a travel history, asking questions about any other potential exposures to known COVID-19 patients, to help determine whether or not testing would be appropriate. In addition, if they do come in to the primary care provider or an urgent care or an emergency department, they will do a rule out where they may look for other respiratory illnesses such as flu. And if those are negative, then testing for COVID-19 is recommended. So once it's recommended, then either that facility who's done the rule out may provide the COVID-19 testing themselves. Some primary care doctors may not have the training or the personal protective equipment. And then we're working with the Ohio Hospital Association currently to refer those patients to testing and assessment sites where they can take either an oral or nasal swab and send it in to the Ohio Department of Health lab for testing, or to several private labs who are currently testing.
Well, while we're on that subject, you had mentioned before your website. I'm sure information's available for people who want to check to see what kind of symptoms and whether they have them.
Yes, absolutely. We would urge everyone to visit coronavirus.ohio.gov, and we have very clear infographics and other FAQs and checklists to help Ohioans be prepared and to assess their own medical condition before reaching out to a primary care doctor.
Well, thank you, gentlemen, because sometimes people come on and off the call, so I want to make sure that if whatever sites you're referring them to, you might repeat them each time you have an opportunity to respond. And to that effect, Dr. DeCarlo, can you walk us through what a test for COVID-19 entails, and how long will it take to get the results back?
So it's obtained through a nasopharyngeal swab. And so the way we obtain that sample is we actually just swab the inside of lining of your nose with a Q-tip. Currently, it takes about 2 to 7 days for the test results to come back, but we're hoping in the near future we may be able to get the results back on the same day of testing.
There's been some discussion that there's testing that's coming online that allow you to find out within 8 hours. Have you heard that as well?
Yes, sir.
It's not necessarily available to everyone at the moment, but there is that discussion out there on the internet. Dr. Collins, what happens if an individual actually tests positive for COVID-19? Are they quarantined at home or in a hospital?
The vast majority of people that will test positive will likely have mild symptoms, so they will be quarantined at home. And actually, since they have tested positive, they are actually, the word we use is isolation. We only refer people to the hospital for clinical care in the hospital if they have symptoms that cannot be managed at home.
And I understand from what I've been reading too, that if in fact any folks had elective surgery planned, that they should put it off for another day to allow Drs. DeCarlo in the University Hospitals and Dr. Collins at Metro and any other institution to be able to handle those people that are coming in who might be suffering something that would require time in a hospital. Is that correct?
That is correct.
Well, understandably, there are a lot of questions and concerns when it comes to testing for COVID-19 and the impact of a positive test result will have on someone and their family. So our late Friday night, Saturday morning vote was a bipartisan bill that called for Families First Coronavirus Response Act to help provide Ohioans here at home and their families with the resources necessary to tackle the health and economic challenges ahead. That bill provides $1.2 billion to help cover the cost of the coronavirus testing. That includes $142 million to eliminate the copay requirements for service members and veterans. This will help ensure that all individuals, including those with private insurance, Medicare, Medicare Advantage, Medicaid, CHIP, and TRICARE, as well as the uninsured, will have access to tests. Probably one of the most common questions I hear about testing is whether or not it's free. Mr. Hyams, can you speak to that?
Yes, thank you. So certainly from the Ohio Department of Health's perspective, we have a public health laboratory that is performing tests for some of the more severe cases and those cases that are hospitalized. We are performing those tests free in terms of the cost of the analytical process. I also understand that Medicaid is covering the tests and many private insurers are also covering the tests in terms of the collection of the sample and then sending it to the ODH lab. If you're using a private laboratory, I understand there is a cost involved with that, but coverage, whether it be through Medicaid or private insurance, should be covering that in addition.
You know, Dr. DeCarlo, I was glad to see that University Hospitals and the Cleveland Clinic announced they had partnered to provide drive-through COVID-19 testing for patients. Can you provide more details on that?
Yeah, so, one of the things that's really great about this is it's really immediate access and it's also convenient. So on Saturday, we actually stood up our first drive-through COVID-19 testing site, and this was actually done in collaboration between the Cleveland Clinic and University Hospitals. And the first site is at the O.H. Walker Building in University Circle. And then the good news is we actually opened another site this morning, and that's at the UH Landerbrook Health Center in Mayfield Heights. And then we're considering further sites, and that'll obviously decided between joint decision making between UH and the Cleveland Clinic, and then obviously in alignments with the public health needs. At these drive-through testing centers, what will happen is a caregiver in personal protective equipment, they will take the person's temperature, they'll check for breathing difficulties, and they'll swab the patient to obtain a sample to be sent to the lab for testing.
That's fantastic. I mean, Dr. Collins, what precautions are being taken by healthcare officials to prevent the spread of COVID-19 in doctors' offices or hospitals between those who come in to be tested and are quarantined and individuals who are there for their other health concerns?
Well, certainly you mentioned one of the steps already, and that's postponing elective procedures that patients may have. But the other steps that hospitals are taking are asking their patients to contact their providers if they feel ill prior to coming into an appointment, screening all visitors and employees as they're coming into the hospital to see if they're showing any signs of the COVID-19 illness, as well as taking steps to protect the healthcare providers, ensuring that there is a supply of personal protective equipment and that staff are trained in how to properly use it.
Is there Dr. DeCarlo, is there a concern in Northeast Ohio hospital systems about a shortage of any of these medical supplies or medications?
At the current time, there's no shortage of medications to care for COVID-19 patients. However, we are concerned about future availability of things like masks, gloves, face shields, and even swabs to perform the testing. The good news is, though, there is an increase in availability of the reagents to be able to perform the COVID-19 test.
Well, the Family's First Coronavirus Response Act also provided $1.25 billion to provide emergency nutritional assistance for senior citizens, women, children, and low-income families, as well as $15 million for the IRS to administer tax credits to help small businesses provide paid sick and paid family and medical leave for workers who test positive for coronavirus and cannot work. And while I can assure you that Congress will continue to take action to address the impacts of the coronavirus outbreak, I encourage everyone to take proactive steps to be prepared as possible to combat this disease. Mr. Graham, what can someone do to prepare if they or a family member gets ill or if the community experiences a spread of the coronavirus?
Yeah, certainly. I think the media out there is doing very well, maybe too well sometimes, letting everyone know this is going to spread, it's going to expand. So really, to protect the community and your family, we want people to know where the best information is. Please don't go on Facebook and get information that may not be true. We want them to go to legit sites, the hospitals, Center for Disease Control, www.cdc.gov, Ohio Department of Health, Mr. Lance Himes and his group, or the Lake County General Health District. And then again, we're back to the thing, be aware of your symptoms. If you have symptoms, if your children have symptoms, your neighbor, stay home when you're sick. Connect with your local healthcare provider. Limit movement. You'll see some aggressive actions by the state of Ohio, limiting bars and restaurants and public gatherings. And that's going to be critical in slowing down that bell curve, the big spike that we saw in China. I can't emphasize enough. If you don't need to go out, please do not go out and interact with individuals. Know what your risk factors are. Have a plan to address those. Again, we're trying to protect the healthcare system by slowing this down as much as we can. And as a community, we only really have one shot to do that efficiently here, and it's early on, and it's we need 100% participation. Spacing, 6 feet is a good requirement, kind of arm length from each side to side. Keep away those from those individuals if you can. Again, clean surfaces, cover your cough, your sneezes. Wash your hands cannot be said enough, so we'll stick with that. Again, look at contingency plans for telecommuting, daycare issues. This is a changing environment, and as much thought as you can put into it in the early phase here, the better we will come out through on the other side.
Well, I've heard some people ask about whether blood donors are needed to help with this COVID-19. Dr. DeCarlo, can you speak to that?
Well, in general, COVID-19 patients don't lose blood, so donating blood would not necessarily be helpful in a COVID-19 situation. However, as an emergency medicine physician that works in a trauma center, we are always very happy to hear about people donating blood. But again, it wouldn't necessarily help with COVID-19.
But if it is needed, how do people who want to donate blood make an appointment to do so?
So generally, they would often contact their Department of Health, and then often hospitals and other departments have blood drives throughout the year.
One question. Speaking of hospital folks and Dr. DeCarlo, what precautionary measures can healthcare providers take to protect their employees, like nurses, during this outbreak?
So one of the things that we're working very, very diligently is making sure that everybody is wearing protective equipment. So when we have a patient that screens to be high risk, we want to wear the appropriate eye shields. We want to wear masks. We want to wear gloves. And then, as stated numerous times, we want to wash our hands. That is very important before and after evaluating patients.
Well, you know, Mr. Himes, to many people, the idea of a quarantine can be daunting, depressing, or even stressful. What can be done to help those who are isolated or quarantined during this outbreak?
Yes, thank you for the question. I mean, certainly we want individuals who are either isolated, and isolation is when somebody's actually been diagnosed. Quarantine is when somebody has been exposed to somebody who's been diagnosed, and the quarantine individuals are not yet showing symptoms. But certainly we want to show compassion to those individuals, to also offer assistance to them, whether it's dropping off a meal at their doorstep or running errands for them while they're confined to their home if they're not otherwise hospitalized. Certainly for those that are quarantined or isolated, we'd advise that they keep their distance from other asymptomatic friends or family. Stay in their bedroom, use a separate bathroom that's not going to be used by other members of the household. If they are sick, they should be wearing a mask when they're around others and staying at least 6 feet away. We would advise that they not leave the home. I know it's difficult for many of us who are busy and have things to do, but if they're not feeling that ill, which we know that some of the symptoms of COVID-19 have been on the milder side, they may be tempted to go outside, and we'd urge them to stay quarantined and isolated, and then have other people maybe call and have some of that social interaction, use FaceTime or other texting to stay connected to friends and family. Also, they want to assure that other members of the family wipe down high-touch areas with disinfectant, including doorknobs, light switches, phones, remote controls, sinks, toilets, things like that. And also, finally, limiting limiting contact with their pets. We've heard some reports that this may be transmitted from humans to animals. I know the science is still evolving, but those are some of the most recent tips if you're isolated or quarantined.
Well, Mr. Himes, I had a constituent ask about what resources are available to family members who are the primary caregiver of a person with dementia. If a person with cognitive impairment is living alone and their caregiver isn't able to visit, what would you recommend?
That's a great question, and I think perhaps using technology, like I mentioned, whether or not using a laptop or FaceTime. I know an individual with dementia may not be able to interact with that type of technology, but certainly the precautions should be taken, wearing a face mask, and then perhaps other individuals in that home should wear personal protective equipment when interacting with that individual. I think these are very challenging times, and would encourage folks to be creative in providing that social interaction with people while they're quarantined.
Those are great tips. Thank you for that. Mr. Graham, locally here, another constituent asked, so much focus on not touching your face, mouth, eyes, nose, hands, hand washing, use of hand sanitizer, and maintaining a 6-foot social distance, monitoring for symptoms, self-quarantine, etc. What about infection through a skin injury, such as a cut or dry skin, which may result in cracked hands? Virus be contracted that way?
Yes, the skin's a great barrier, but it's also can be easily absorbed. So there's ways that the epidermal crossover. But certainly with any kind of injury, any open wounds to the body, I'm sure the doctors can verify this. It breaks down your integrity, breaks down that protection. So you do really want to make sure those wounds are closed up, and certainly again distancing is all the things that you mentioned are key. But certainly a break in the skin puts you at a much higher risk for the virus.
Well, I know all of you took time out of your very busy day working to keep Ohioans safe from this outbreak to join the call, and I don't want to take up much more of your time. But to conclude, I'd like to ask each of you what you think the most important takeaways are for all the information people getting about COVID-19. And if you wouldn't mind, we'll go down the order. I'll start with you, Mr. Himes.
Thank you, Congressman Joyce. No, I think the most important takeaway is that this is an unprecedented challenge for public health and for the United States. I think everybody should realize the seriousness of the risk, and also take those steps that are within our control to prevent further transmission. And so I know it's difficult for a lot of us, me included, and I have kids and they want to go out and see their friends, and we've told them that during this time, they need to stay at home. So I think staying at home, if at all possible, is the most important takeaway to really blunt the impact of the transmission of the disease. So it will preserve our healthcare system and their ability to take care of those patients who need that hospital care.
Thank you, because I know there's some great challenges here moving forward, and we need to work together to mitigate this outbreak in our communities. Dr. DeCarlo, any words of wisdom?
So I think everyone would agree that in some form or fashion, this pandemic has touched every person in this country. So really, each person has a responsibility to do their part. And part of that is what Mr. Hines already alluded to and spoke to. But the other is really, it's really following all the guidelines, making sure we don't panic and overreact, and but on the other hand, making sure we do our job and to help protect our loved ones and our neighbors and our own self.
And Dr. Collins, do you have any parting advice?
I do. I think everyone has a sense of anxiety about this, and certainly it can be fueled by what is going on in the media. I think everyone should know that we really have outstanding public health leadership coming to us from the CDC, Ohio Department of Health, as well as our local health departments. And they're providing wonderful coordination and direction for this rapidly changing crisis. We are fortunate to have those professionals. They and the hospital systems are working very closely together to help best serve our community. So we have talent in Ohio, and we're strong at what we do. And so I'm hopeful that we'll be able to navigate this as best as possible.
Well, thank you. Those are good points as well. And Mr. Graham, do you have, from your position there, Lake County Health Commissioner, could you have any thoughts, last-minute thoughts you want to provide for us?
Yeah, we certainly want to keep a level of calmness in the community, but we also want to make sure this is very serious times. It's a lot of unknowns. It's vitally important that we all do our part to protect the people in our community. So while you may contract the virus and only have mild symptoms, and even some may not even realize that they have it, you can certainly spread that to somebody that's at high risk. So you feel kind of indestructible and then you're feeling well, please don't use caution in interacting with others, because that may not be the case for them. Their health may not be in good condition. You will know that it's going to take us kind of pausing the world for a little bit and hunkering down to beat this thing.
Well, again, I want to thank you again, Mr. Himes, Dr. DeCarlo, Dr. Collins, and Mr. Graham for joining me today on this telephone town hall and helping me provide the 14th Congressional District with accurate and up-to-date information about the coronavirus outbreak. And thank you to the thousands of constituents who took the time to listen to this important informational discussion. Remember, we're in this together, and we all have to make this work. Dr. DeCarlo brought up a good point about everyone being touched in this, and this is the time for us to all do our job together. Now, if you still have questions about the outbreak that need answering, the Ohio Department of Health has a call center dedicated to doing just that. It can be reached at 1-833-427-5634. If you have any other questions or concerns you would like to address, you can contact my office by calling toll-free 440-637-8030 or by visiting www.joyce.house.gov. It is my honor to represent you in Northeast Ohio and U.S. House of Representatives. And I got to say, stay safe out there. Be well. God bless you. God bless the United States of America. And let's say a prayer for America.